Hi, I'm Robin Newhouse. I'm Professor and Chair of Organizational Systems and Adult Health at University of Maryland. I was appointed to the Methodology Committee of the Patient-Centered Outcomes Research Institute by the Controller General in January of 2011. I'm here on behalf of my colleague and friend, Deborah Barksdale from University of North Carolina, who was appointed by the Government Accountability Office to the PCORI Board of Governors. So I'm going to talk to you about one of our major funding opportunities for nursing. First, I'll familiarize you a little bit with PCORI. So how many people know about PCORI? Good deal. Oh yeah. How many people of you were funded by PCORI? All right, next year I expect to see hands in the audience. Okay. Patient-Centered Outcomes Research Institute was formed by statute from the Affordable Care Act. And the Board of Governors were appointed a 21-member board to govern PCORI. PCORI is focused on comparative clinical effectiveness research. So this research by nature is patient-centered. It answers questions that are important to people and clinical decision makers, and uses comparisons of outcomes that matter to patients. There are three specific goals for PCORI. Number one, increase the quantity, quality, and timeliness of research information. Two, to speed the implementation and use of evidence in practice. And three, influence research funded by others, the three major goals. It answers questions for its funded research like this: given my personal characteristics, conditions, and preferences, what should I expect will happen to me? What are my options, and what are the potential benefits and harms of those options? What can I do to improve the outcomes that are most important to me? And how can clinicians and healthcare delivery systems that they work in help me make the best decisions about my health and my health care? And note, I mentioned yesterday, this is from the lens of the patient. I have to talk a little bit about Harlan Krumholtz. So at the stakeholder launch in Washington in 2012, we brought together a group of stakeholders and clinicians to launch our engagement efforts. And Harlan gave such a compelling speech. I'll refer you back to the YouTube video. You've just got to watch it. Because what he's saying here is PCORI is research done differently. PCORI is research that's focused on the important questions for patients. And in PCORI, the patient is the true north. So I can't do it as well as Harlan, but it's just inspirational and centering in terms of the type of research that's being funded by PCORI. Stakeholder engagement, and that's stakeholders in terms of patients and in terms of people that are interested in these kinds of studies, are included in every step of the PCORI process. They're included in merit review. Patients and stakeholders are included in informing the types of study designs that that PCORI should fund in the evaluation, and then the topic selection. So many of you have probably seen some of the calls for the advisory committees that have been formed. Those advisory committees are the committees that are informing what specific areas PCORI is funding. There are five major areas for the broad categories. First is assessment of prevention, diagnosis, and treatment options. Second, improving healthcare systems. Third, communication and dissemination research. Fourth, assessing disparities. And fifth, accelerating patient-centered outcomes and methodological research. So that's the one I'm most involved in. So our review criteria is a little bit different. It's a lot different. Of course, we're interested in scientific rigor and approach, but we're interested also in the impact of the condition on health of individuals and populations, the potential for improving care, the value of the information gained, the technical merit, the patient-centeredness of the proposals, and the patient and stakeholder engagement in the research. In addition, if you submit a PCORI proposal, you need to comply with the methodological standards. There were two things in the Affordable Care Act that we needed to accomplish. Number one was to create standards for comparative clinical effectiveness research by May of 2012, which was a feat in itself. These are minimal standards for comparative effectiveness research, and there are 47, so if you submit a proposal, you need to consider each one of these minimum standards in your proposal narrative. In addition, we were charged with creating a translation table to help guide the design and methods used in the types of studies that PCORI funds. So nursing research is incredibly aligned with what PCORI does. I'm going to just very quickly flash through a couple of people. I won't talk about each one. We don't have enough time, but let me just give you a highlight of some of the nurses that have already been funded. So far, $464.4 million of funding has been allocated in 39 states. I'm hoping to see your picture up here. I'm going to stop, and I'm just going to say there are lots of ways for you to be engaged. I will send these in a PDF file to SNRS so that you can have a copy of these slides and get a little more detail on the funding. And I would encourage you to engage yourself with PCORI, either as a stakeholder, as a merit reviewer, volunteering for the clinical advisory panels or and the research advisory panels, and encourage you to submit for PCORI funding. Thank you.
Wonderful.